Hello, this is Dolores Clivert, the host of For the Love of Baby Boomers, and I want to welcome y'all back to this show. Today is going to be an awesome show, a very enlightening show, a show for our health. We have a guest today that is going to be awesome. Her name is Sitrena Woodson. She's actually a returning guest, and she's going to talk about chronic illnesses, and also she's going to talk about what's this month? We're looking at
sickle cell awareness.
Sickle cell awareness. Yes, a very important topic. And I want to introduce you. Sitrena, welcome back.
Thank you for having me today.
You're welcome. So, Sitrena, you're going to be talking about chronic illnesses. Is that correct?
That's correct. And sickle cell. And the reason I want to incorporate all of it is because we know sickle cell is a inherited disease. It's a blood-borne disease that people are born with. And there's many factors involved with sickle cell. Mm-hmm. And it's Sickle Cell Awareness Month, and I'm definitely an advocate. Mm-hmm. But one of the things people don't realize is that sickle cell is a disease that really is not what alters your life. It's the damage it does to your organs and your tissues that really cause the chronic illnesses that need to be followed up on. And so, like, sickle cell can deplete the oxygen in your blood. So you are breathing in the right amount of oxygen, but because you have very little red blood cells, your body doesn't process the flow of blood correctly. And it can create something called, and some of these words are really big, right? But arthovascular necrosis, which means dead bones.
Right. Osteo means bone.
Yes. I've had my left hip replaced twice because I don't get good oxygenation in my blood flow. And so my bones are very easy to break. So I have a pin in my finger because if I fall, I can break something quite more easily than other people. And that's only because my bones are drying out because I don't have good oxygen.
Well, Sitrena, I have to stop you for a minute because I met you for the first time maybe a month ago. And I didn't know anything about you, your health or anything. And I'm telling you, you look great. You carry yourself well. You surprised me when you just said that.
Thank you. And that is because at 42, I grew up thinking I only had sickle cell traits. Mm-hmm. At 42, because we know stress kills, right?
Yes.
But stress is another thing that if impacted by your sickle cell, because it constricts your veins and your arteries that carry not just the oxygen, but your blood flow. So if it's constricted and blocked and you're stressing, it makes your blood vessels even smaller. So that my kidneys have been impacted. So they say, again, necrosis, dead cells.
Right.
I have kidney death. So my kidneys will act up sometimes. So they said I have stage 2 kidney disease. One of the things that they did when I was 42 is they said I have full-blown sickle disease. And the disease that I have is known as sickle thalassemia, which is supposed to be a very mild case of full-blown sickle disease because you have sickle cell anemia where those people have those painful crises. They have sickle chest syndrome. They can get strokes. They can have seizures. I mean, like, it goes on. And those people are usually sick from infancy. And at one point, they had a shortened life expectancy. But now things have progressed so that most sickle cell people have a full life expectancy. So you have sickle cell anemia. That's the most severe form. Then you have sickle, I think it's called sickle C. I don't know all of them, but I know one is sickle anemia, then you have sickle C, and then you have sickle thalassemia, then you have sickle trait.
Well, so, you started with sickle cell trait. Is that what they started by, diagnosing you at 42?
No, when I was a child, they said I had sickle trait.
When you was a child, okay. And then you developed over time.
Nope, I always had it, but they didn't know because sickle
Oh,
cell disease has typically been associated with African Americans.
right, correct.
And so the research dollars that people were putting in for sickle cell disease was really not as prevalent as the research dollars that people were putting into cancer and
Mm-hmm.
a whole lot of other common chronic illnesses. So they were not testing for sickle thalassemia when I was born. It was just not a normal, full blown across the board test. So when I was 42, as I was saying about stress, which is another chronic illness,
Mm-hmm.
I was working. I had two children under high school age. My parents, my mother had dementia, and I was a college student. So even though it didn't seem like I was under stress, I was under a lot of stress and my body started breaking down. So my
Yeah.
kidneys started failing, my hip went bad, like
Mm-hmm.
things
Dark
just went
side of
off the rails, and they thought I had kidney cancer.
Mm.
When I went to VCU, they found out I had sickle thalassemia. And
Okay.
then they retired me from work because they said, I wasn't going to be able to keep working in that condition. But what my job became was to manage my symptoms and to stay healthy. So I had to learn how to eat right.
Right.
I had to learn how to protect my body from extreme temperature changes and swings. I had to learn how to get rest. So I'm 40 something and I'm the Energizer Bunny. And now they're saying, well, you're going to need to take a nap in the middle of the day, and you need to make sure you get 8 to 10 hours of sleep. So it was a major life change for me.
Okay.
But again, it's managing all of the things like one of my retinas, because again, with the blood flow, it can impact your eyes. So one of my retinas has a hole in it. So they're always saying, I'm at high risk to have my retina detached. It's always something that you're on the lookout for, or something else that you're trying to baby to make sure that it lasts as long as it can last.
Yeah.
So with chronic illness, I've been a proponent of nutrition, which is a reason I love to garden.
Mm-hmm.
I love exercise. Well, no, I don't. I don't love exercise, but I'm good at it.
Okay, so you
I
do
enjoy
it.
and I'm committed to it.
Okay.
So, when my hip is not hurting me too bad, I'll go out and walk as far and as long as I can. I've learned that water aerobics works better for me
Yes.
than on the ground aerobics. So it's just, how do we manage chronic illness? In gardening, I've had to learn not to garden in ground, garden in
Right.
beds or garden in bags, so that I can bring the garden to me instead of me having to go to the garden.
Yes, I
It's
know
a
what you
lot of
mean.
things,
Yes.
Yes, and nutrition, resting and pacing myself, how to stay calm and how not to worry. And, as we get older, there are a lot of things that concern us more than when we were younger. As I was saying, even about driving, since my sight
Dark
isn't that
side of
good,
cancer.
I
What
tend
they
not
never
to take a lot of chances driving. If I don't have to drive in the rain, I don't. If I don't have to drive at night, I don't. If I can have somebody in the car with me that's a licensed driver, I prefer it. So it's just, how do we change our mindset as our bodies change?
Exactly. That right there says a lot. You have to make changes. You have to recognize, know your body, and make changes. Yes. Yes.
Yes.
Mm-hmm.
And one of the things that I realized is, at 42, and I was on Medicare, and now I'm on Social Security, and then I'm retired. Everybody kept saying, well, you don't look that old.
Mm-hmm.
And it started making me feel old because I wasn't doing the things that most 40-year-old people were doing. Now I'm seeing the doctor more often. I'm in the hospital more often. I'm having to worry about wills and estate planning. And
Right.
I'm worried about, how is this going to impact my children and my family? So it is a mindset. And a lot of people, are still not that comfortable talking about therapy. But I'll be the first one to tell you, it's not an easy path to take, because in therapy, you have to find somebody that you really, just like with a friend, you have to find somebody that you can talk to, that you're comfortable with, that understands you,
Right.
and that you can really work through your situations with.
Yeah.
But it's worth doing the work. And I am definitely a proponent and an advocate. You know, if you're working through some things, go find somebody, an objective, somebody that can bring positive to you, and go to therapy.
And that's what we should do in every facet of our life. Bring
Yes,
somebody on that can see things through better, different eyes,
yes.
caring eyes. Yeah, absolutely. Yeah. You know, as you talk, there's a lot that I can relate to. To start with, I have sickle cell trait myself. That's why I asked you, did it develop? Because I'm like, I
No,
don't.
it doesn't change. Thank God it does not change.
Thank
And thank
God.
God they now have a cure.
Hmm. Well, what I would say, we have a few minutes left for this segment, but one of the things that I would say is from what you're saying, know your body. Take
Definitely.
tests. It is a DNA thing. It is genetic. So
Yeah,
what's your status? Do you know if you have sickle cell trait or not? And
definitely.
because it's a DNA thing and it does affect mostly African Americans, what, what do you think about that? It may affect you. It may affect your children, your grandchildren. And years ago, when you got married, they did those testing for you so that you knew if you had the trait and your husband had the trait to, be careful
You
when it.
stand a greater, yeah, you stand a greater chance. One in
Yeah,
four of your children, if you have the trait and
exactly,
your husband has the trait, one in four of your children could have full-blown sickle disease, which is
exactly.
what happened with me. Like I had sickle thalassemia, but my husband also had the thalassemia trait. And when my daughter was born, by the time she was 3 months old, she was having seizures.
Mm-hmm.
And come to find out, she had thalassemia. She didn't have sickle thalassemia. She had thalassemia disease. And
Mm-hmm.
just like you were saying, it's mostly an African American. We
Mm-hmm.
have mixed so many of our races, not trying to be derogatory in any way,
All
but we
right.
have literally mixed so many of our genetic lines
That.
that
Mm-hmm.
sickle cell is impacting almost every line of,
Exactly. It's spread out of the community
yeah.
of African American to almost everybody. Yeah.
Yeah, and it's sad to say, but that's probably what helped us get more funding, because one thing I've learned over the years is the same things, the treatments that they use to treat cancer are
Mm-hmm.
some of the very same therapies and medications that I've been receiving as a sickle cell patient.
Mm-hmm.
And the same thing that they use to cure sickle cell, bone marrow transplant, is the very same thing they use to cure leukemia.
Okay. So we're ending this segment, and I would like to say that this is September. We recognize sickle cell anemia and